Port Macquarie is a really beautiful town. It is on the mid-north coast of New South Wales, halfway between Sydney and Brisbane. We've got a really long stretch of beautiful coastline. My name is Mel Freeman. I'm the owner of Port Macquarie Wound Care Clinic. The areas where we work and care for people is the Port Macquarie Hastings region and the Kempsey-Macleay region. The population of Port Macquarie is approximately 90,000 and the average age of people living here is 49 years old. The Kempsey-Macleay region has a population of about 30,000 with an average age of about 48, 49 as well. The services that we provide here are primarily wound care and wound prevention, health education, health prevention and healthy ageing. I've wanted to be a nurse since I was probably 3 or 4 years old. I used to put band-aids on my dog, and as a teenager I would watch nurses and think I wanted to be like them. Before I was here, I worked within the public health system and I saw a really big gap in how people were being looked after. So I decided to give it a go myself. So when we came out to this side, which is primary healthcare, I discovered a whole new world of nursing. I was able to witness people living within their own homes, how they were being cared for, what they needed. And I am so glad that I made the change to primary healthcare. What I have tried to create here is a space where nurses work to their top of scope of practice and continually expand on their skill base. It is really empowering for nurses to be able to put further tools in their tool belt and be able to deliver care safely like this within the community. A typical day in the life of a nurse that works here, they come into the office, pack their bags, they get their patient list and take one of our cars and they go out to the community. The people that we look after in their own home are often very complex, and they're the people who take up the beds in the hospitals for a really long time. The more that we can kind of work with the public health system, it really does keep patients at home longer and keeps them out of emergency more. And then we also have our on-site clinic here for the more advanced wounds where there's usually 1 or 2 of us nurses working here at all times. Some of the patients that we go out and look after, we go through 5, 6 farm gates, but they're people that can't come in here to clinic or to their GP. So it's really empowering and really lovely to be able to go out and provide the same care to them as someone that would live in town in Port Macquarie. We've had so many patients who've given us happy testimonials. There are people who have lived with chronic wounds for many, many years who have been able to get to a stage where they're really quite comfortable and they're able to live their life much easier. APNA's assisted me so much with this project. Having that constant line of support and encouragement and also direction within this project has really helped because we have challenges at times being a nurse-led clinic. We've been able to develop really different ideas to help with healthy ageing and injury prevention. I find it such a privilege to look after people in their most vulnerable states, and also such a privilege to be invited into people's homes. That's their safe space.